All right. Well, thank you everyone for joining today. It's a great pleasure. I'm joining you from Meharry Medical College as director for the Center for the Study of Social Determinants of Health, and joined here with a number of titans for equity, not only in the work that they're doing, but the way they carry themselves out and the initiatives that they start and run. And I'm really excited for the inspiration they've gained for not only myself, but many others across the country. And want to be very grateful that they'll take the time to share a little bit about some of those programs and some of their perspectives that they've learned over the course of this COVID era and where we can go moving forward. So I'll take a brief moment, starting with Dr. Adams, to give a brief introduction, and we'll kind of go around the room here with some brief introductions, and then we'll kick it off with some of the lessons that they've learned and some of the best practices that have come about as a function of their experiences.
Well, Brian, thank you so much for having me here today. It's great to be on this panel, and I'm really excited to hear from my colleagues about their perspectives. But from the 30,000-foot perspective, I served as the United States Surgeon General, and prior to that, I ran the Indiana State Department of Health. So I've seen health play out on a federal level, on a state level, and on a local level. And we know that digital health, that virtual care is critical to making sure people can access the services that they need and actually live in an equitable environment, meaning an environment where people have the opportunities to make healthy choices.
Thank you, Dr. Adams. And Dr. Greeley, if you could give a brief introduction as well.
Thank you, Brian. I'm Mary Greeley, president of the Healthcare Leadership Council. And we're a trade association, health policy trade association in Washington, D.C. Very unique in that our members are CEOs of different healthcare companies, both for-profit and not-for-profit, but representing all the different sectors of healthcare. So we have health plans, health system, medical device manufacturers, pharmaceutical companies, health information technology companies. We also have the large distributors and pharmacies and clinical labs and others, post-acute care as well. As you can imagine, all of our members were very engaged in working on the pandemic, and we partnered with them on many, many issues, trying to make sure that we were getting healthcare to everyone as quickly as we could. I must say, one of the big lessons learned for us was the importance of public-private collaboration, and that we really found that the public sector could not do it all by themselves, and certainly the private sector could not either. And I think all of us were aware of the disparities in health that we saw. So we're very focused going forward on using that public-private partnership to address disparities in healthcare. And I'm sure we'll be talking about that a little bit during our discussion today.
Absolutely. Thank you so much, Dr. Greeley. And speaking of some public-private partnerships and some programs that help push them forward, I'd like to kick it over here to Dr. McMahon, and if you could give a brief intro and some of your perspective on lessons learned as well.
Sure. Thank you very much for having me. It's a real pleasure to be here and hear from my colleagues and tell you a little bit more about NIH. So I direct the SEED office at NIH, and you can think of SEED as kind of an in-house accelerator or incubator that helps to transform more of the basic science discoveries that are funded by NIH into products and services that can help people and really transform these scientific ideas into products and services that can save lives and improve human health. So NIH is the major funder of basic science research in the United States, and people are generally aware of that fact. We're providing about $40 billion to scientists and researchers around the country every single year. And what we're committed to doing is to creating programs and services that enable those investigators to take those discoveries and apply them to some of our most pressing healthcare concerns around the country. And, you know, if we've learned anything from COVID and this public health emergency, it's that there are striking health disparities, shocking health disparities that we really need to learn how to address. And part of the way that we're attempting to address them at the NIH is to bring a more diverse set of stakeholders, researchers, and others to the table who can really not only identify the problems that affect them and their communities, but receive the funding and the support from NIH to really go after those problems. And so that's really been a major focus of the SEED office.
Very much appreciate that perspective. And actually, as a small business owner myself, and in part inspired to launch that behavioral health company because of our next panelist here, Dr. Jankowska, when I was interviewing with her out in University of California, San Diego, before her new role here at City of Hope. And I'll let you take it over, Dr. Jankowska.
Thanks. My name is Marta Jankowska. I'm an associate professor at City of Hope. We're a NCI-designated cancer center serving Los Angeles and several other surrounding counties. And my lab and a lot of my colleagues are really dedicated to understanding some of these huge disparities that we see in not only cancer rates, but differences in treatment outcomes. And my general interest is particularly in geospatial and geographic approaches to understanding why we're seeing these huge social disparities. So I'm definitely eager to talk more about some of the big data sets that we can utilize in these types of research projects, the different initiatives that are going on across the United States to try to link big data and big geospatial data to health outcome data. And eager to hear what everyone else has to say on these topics.
Thank you so much, everyone. I imagine we could actually spend the whole keynote time to each one of you just on introductions, let alone any of the subsequent questions or topic areas. So appreciate you all participating again. And I'm going to throw it back to Dr. Adams to, again, kind of see his perspective of what he saw during his tenure as leading the country as Surgeon General and kind of the bigger steps that he's recognized and helped lead and where we're going from here.
Well, thank you. And the Surgeon General's job is to raise awareness about health risk factors that people should know about and that they can take steps to mitigate. And so while I was Surgeon General, I was focusing initially on the opioid epidemic because we unfortunately know that even back then there was a person dying every 11 minutes of an opioid overdose. And we've blown away that unfortunate record in the last year with over 100,000 people who died last year. But COVID really, kind of just overwhelmed everything else towards the end of my tenure as Surgeon General. And what I want to remind people is COVID isn't the problem so much as it's the symptom of underlying problems. We knew long before COVID who was going to be hard hit by a pandemic. We knew it was going to be people who didn't have equitable opportunities for health, people who were going to have challenges with transportation, people who were going to have challenges with jobs that didn't have health insurance, didn't pay a living wage, or didn't give them paid time off. We knew that these things were going to come to the forefront if a pandemic hit because they were already causing disparities in cancer outcomes, in cardiovascular outcomes, in maternal mortality outcomes. And so as Surgeon General, I really tried to focus on the root causes of disease. I put out calls to action on hypertension control, on maternal mortality, on suicide prevention, and on skin cancer prevention. And in all of those, I focused on what should we be doing upstream to deal with the issues, and not just what treatments can we provide to people after they've already fallen off the cliff. And one of the areas that I particularly focused on was virtual care and improving digital health. We know that for hypertension control, there are lots of research studies out there that show that you can get people better under control through virtual care and virtual visits, particularly when you link an automated blood pressure cuff to Bluetooth and give that feedback directly to a clinician so that they're getting day-to-day, minute-to-minute feedback about your blood pressure, as opposed to coming in once every 6 months and trying to tweak your medication a little bit. With maternal health, we saw that maternal mortality went down when we improved access to prenatal care and to virtual visits for moms. Because in many cases, those moms can't make it into an appointment. They may have other children. They may have a job. They may have other difficulties with transportation that don't allow them to come in person. But you can do a lot of the education and a lot of the visits virtually prepartum, but then also postpartum, connecting moms to moms virtually. So that was a big deal. As far as suicide prevention, many people who are reticent to come in to see a psychiatrist or come into an office for mental health care are perfectly willing to pick up their phone and actually engage with someone virtually. So these are all places where we can use digital health to actually improve outcomes. The studies show it. The one thing I would say in closing, just as I talk about this, is that we have to recognize that broadband access is a social determinant of health, because digital health is great. Virtual care is fantastic, but it means nothing if you live in a community where you don't have access to broadband. And again, we saw this symptom come to light when COVID came around, and you tried to get kids to get virtual schooling. And in many cases, there was inequities in who was able to be educated when we were in quarantines, when we were in lockdowns, because not everyone had equitable access to broadband. So that is a social determinant of health. And if we address it, then I think we can deliver more equitable care to more people.
Thank you so much for all you've done and continue to do. Just to make sure all of the audience members understands the term social determinants of health, because sometimes it gets many different definitions. We here at the center typically just go off the World Health Organization or the Healthy People 2030 kind of definition about where people work, live, and play, and the barriers that kind of get in the way to equitable healthcare and health outcomes. So I know that Dr. Greeley here has been leading a number of initiatives around this topic, and I'd love to get her perspective on some of the key areas that they've learned and kind of help kind of blazing the path forward for how we can best address some of these.
Well, following on what Dr. Adams said, I would say COVID-19, the pandemic, really shone a very harsh light on the disparities in health. We sort of knew about it. A lot of us had started working on social determinants of health, but I think this really brought it front center. You couldn't ignore it. And it was just such a stark reality. On the good news side, I think now we have recognized this reality. And during the pandemic, there were certain waivers that really enabled us to do things like telehealth. Made a huge difference there. And I would say, we had seen telehealth growing, digital health growing. It exploded during the pandemic. And there is no way that we're going to put that genie back in the bottle. And a lot of my work is with Congress and the regulatory agencies, and we are fighting hard to make sure that we can continue to have that access. As Dr. Adams said, we really saw this as a great aid in expanding access to behavioral health. It expanded care for everyone, but I would say particularly important and critical was in the mental health arena. And it just turned out to be such a great tool. And again, I don't see us going back to the way things were. What we're doing in our organization is taking a deep dive on health disparities and what are the variations in care, and working with an outside entity to interview our members. Not only what are you doing, but I think more importantly, what are the barriers that you're seeing that are getting in the way of you really addressing the disparities in health and the social determinants of healthcare. So we're going to survey our members. We're also going to do a literature survey to find out what are the best practices out there, as well as the barriers that we're seeing. And can we really develop sort of a game plan for addressing these in a very structured, concrete way, and try to make a difference in addressing the health disparities. And I'd also underscore, again, what Dr. Adams said about the need for broadband access. And delighted to say, I feel we're making progress on that with Congress, that they do understand there's a need for funding. And I know that the FCC has been charged with looking throughout the country and developing a map of where are the underserved areas in terms of broadband access with a real focus on healthcare. So I am the eternal optimist But I think as bad as this pandemic has been, there are some good things that are going to come out of it.
Appreciate that perspective. And kind of thinking of other disparities that have kind of come to light, even in the small minority-owned business area, for example, and where that funding comes from, and our workforce and our workforce representation, I think, has been a major area that I think Dr. McMahon and his program is very aptly kind of positioned to help resolve. For example, 1% of venture capital funding going to Black-owned business owners, whereas that can be overcome with some of our more potentially equitable solutions through the government. And Dr. McMahon, I was curious, anything that's come to light from your perspective or areas that you're trying to push forward to help this cause?
Well, certainly, as you point out, Brian, increasing the diversity of the entrepreneurial workforce is a major component to solving this kind of broader ecosystem-wide problem that we're facing. And at the National Institutes of Health, partly through the Unite initiative, which is a large NIH-wide initiative to increase diversity more broadly in the biomedical sciences, we've been working in the more localized entrepreneurial space to really try and understand how we can set up programs and provide services that can have a real impact. And you know, as you've pointed out, there's a real disparity in the types of people that are receiving funding to do early stage research and development. In our program, we're providing $1.2 billion every year to small businesses across the United States through the SBIR and STTR programs. And we're congressionally mandated to increase the number of women-owned small businesses and socially and economically disadvantaged small businesses. But throughout the years, we haven't really seen the needle moving substantially in our metrics. And so we're really trying to renew our approach there in three main areas. One way is increasing awareness of the opportunities that are available through NIH. The second way is by really increasing the participation in those programs, actively increasing participation in NIH-supported programs. And then the third way is really trying to provide as much support as we can to ensure success. So we're developing mentor networks. We've developed programs to encourage companies to hire new employees to increase the diversity of their companies. We've done a tremendous amount of outreach together with partner organizations. There's a big push with minority serving institutions and HBCUs. And we realize that some of these programs and projects will take a number of years to pay dividends, but we're investing in these programs and really pushing forward so that we can create a pipeline that can grow over time.
Well, as director of a minority-owned business incubator at an HBCU, I can definitely say thank you for these initiatives. And I do also agree that I think they'll really pave a path forward for opportunities that deserve to be there. You know, we've talked a lot about some of the bigger picture areas where we're seeing kind of just in your face health disparities that need to be addressed. And that really comes down to the data that we're able to see these things and how we measure that. And I'd really be curious, Dr. Jankowska, your perspective on, you know, how we're doing that now, or gaps that you've observed, and your unique perspectives on how we can integrate different forms of data to push that forward and create a more equitable world.
Yeah, I really appreciate hearing these other perspectives, especially the discussion or point about public-private partnerships, because I think the pandemic really, in terms of data, pushed that forward in really unprecedented ways, where companies were opening up their data troves to researchers, to public actors, and we were getting some really amazing information out of that. I almost feel like it was a whole new wave of transparency that we really haven't seen before in terms of the types of data that is collected. I think a lot of people's eyes got opened as to how much data is being collected about us as a society or even as individuals. but two, how that data can be then applied in different formats. So for example, our research team was one of many that was looking at SafeGraph data and looking at mobility. And we're talking about mobility, not just, public transit, but this is actually cell phone data anonymized, but you could look at the mobility from census block group to census block group of populations. And you could, throughout the pandemic, really, you could link that to the types of jobs that people might have in that census block group through, for example, census data. And you saw very clear patterns of census blocks where there was a lot of service workers, and you still saw huge mobility from them, even during lockdown periods, compared to census block groups that had more sit-down management, upper, higher tier jobs where there was almost no mobility. And that right there underscored the differences that the pandemic forced on us, right? That some people had no choice. They couldn't just sit at home. They had to go to work. And that kind of data just suddenly became available to us to be able to actually show that, which is really exciting. One other point I just wanted to bring up as a bit of a reaction to what we've been discussing is the fact that we are really seeing this mix now where public health is, it's always been part of policy, right? We've always seen that bleed. But I think now as social determinants of health are becoming more and more prevalent, not only and we're seeing it in the data, how important it is, we're starting to realize that people in public health we have to become advocates, right? We have to become more politically active just to try to push and show how some of these social determinants really do matter for life course and for all kinds of outcomes. And so, as a researcher, there's only so much you can do to show that connection. At a certain point, that you have to hand the baton to someone who actually is going to try to change the policy. And in that regard, just tying it back to what Dr. McMacken was saying in terms of the pipeline and the workforce, we're going to have to start seeing more and more training of people who can go from A to Z, who can maybe potentially see the life course of something, not just one little slice, but start actually going through the entire process. So yeah, that's my 2 cents and some reactions.
Brian, I'd like to comment on one issue that Dr. Jankowski, many great issues, but you mentioned privacy. And yes, I think we were able to loosen up in some ways some of the restrictions on privacy and use of information. But I think it's a real challenge for us to educate ourselves and the public as to why we want this information, but more importantly, why is it good for patients and future patients for us to have that information, and how are we protecting that information? I've worked on privacy issues for a long time, and I think people are always surprised when they see just how much information is transmitted. But it's critical, and it was so valuable in finding many solutions during this pandemic.
And as Mary mentioned, that's going to be the key, I think, for the next year or two as we transition to a new phase of the pandemic. And that's figuring out which authorities that we took advantage of under a public health emergency should we keep, which ones should go away, and which ones need to be modified in a bit. So we talked about telehealth. And we also talked about data collection. A lot of people don't realize we went from a state where in March of 2020, I couldn't tell the president of the United States how many people we had hospitalized with COVID, to a situation now where anyone in the United States can go to their State Department of Health website and find out how many people had COVID yesterday in their community. But that authority is going to go away if Congress doesn't actually write it into law. So we've got some real important discussions that we need to have. And to Dr. Jankowski's point, we need to empower people to have those conversations, to go to Congress, to go to their state legislatures, to talk to regulators and educate them about what was helpful and what was not so helpful and what their concerns are moving forward. But we certainly don't want to go back to the way things were because it was unacceptable for me being in a position of authority. And it's unacceptable for a community member trying to make day-to-day decisions about how they should protect themselves from any disease or risk factor without having access to what's actually going on in their community.
Thank you so much. I couldn't agree more. And, in the last few moments that we have together for this call, I was curious if everyone, to follow up on that, there's one or two things that, our audience members could do to help push the needle forward from whatever perspective they're coming from, whether they're payer providers or small business owner themselves. Just curious what advice you might give to somebody and how they could actually make that progress together.
Well, I'll be super quick so that way the other folks can have most of the time. As Surgeon General, I put out a first of its kind report called Community Health and Economic Prosperity, Engaging Businesses as Stewards and Stakeholders. And it really made the case that we have to engage the business community to make these changes happen. Dr. McMahon brought this up. We've seen companies like Patagonia, companies like American Express, like Hyatt, like Bank of America, do really innovative things, such as, they shouldn't be innovative, but unfortunately they are in this day and age, like giving moms more time off after they've had a child and creating more women-friendly workplaces, like lowering barriers to people being actually able to get a job. Not every job that says you have to have a college degree actually needs you to have that college degree. They can train you. Like companies that are actually hiring former felons and people with substance use disorder, and recognizing that when you give them a second chance, they're more loyal employees than people who didn't have that on their record, and as it were. And so when we engage businesses and highlight companies that are really building communities, not just building companies, but building communities as a way of fostering a healthy workforce, we actually see a healthier bottom line. Companies that pay attention to ESG, environment, social, and governance issues actually perform better in the stock market. And they're starting to see it, which is why we have some wind in our sails now to continue these conversations.
So much. Dr. Greeley.
Well, those were excellent points. And, one interesting thing throughout the pandemic, and I've heard this from many people, is that their employees were looking to their employer as a trusted source of information. And many of them didn't have that information and would call on many of our members in health systems to, please come and talk to our employees. So it's a strong relationship, and one certainly that they can build on. But I also would like to reinforce something Dr. Jankowska said, and that is the real people in the real world need to educate the policymakers, the regulators, and the legislators. They need to tell their story because I try to be a translator. I try to connect my members and people out there with members of Congress, but there's nothing more powerful than them hearing from their local constituents, the people who put them in office, to tell their story and what they need and what they're experiencing. So I'd really like to reinforce that.
Mary, one of my favorite sayings is that if you're not at the table, you're on the menu. And far too often, the communities that we care about end up on the menu because they're not at the table. So thank you, and thank you to Dr. Jankowska for highlighting the importance of advocacy.
Absolutely. Dr. McMahon, any key tips for how the audience could help?
Sure. I think really highlighting the progress that we made due to coordination and collaboration has really been unprecedented. So within the federal government, the unprecedented speed of COVID vaccine and diagnostic development was really in large part due to an unprecedented new type of relationships that were established between the research agencies, NIH, the regulatory agency, FDA, and CMS and their role in payment and reimbursement. And I think that it's hard to imagine a scenario where we, return to normal from that. I think it's set a new bar for government collaboration, but also public-private sector collaborations. So the engagement that we've had with the investment community and the private businesses that played a role in COVID diagnostic development and COVID vaccine development and other types of digital product delivery mechanisms. It's really been a major change in how we think of the role as government and how we need to really partner with our private sector colleagues and other stakeholders to really turn discovery into health. And that's really the goal of what we're trying to do at NIH is turn discovery into health. So I think that intergovernment coordination and collaboration with our private sector stakeholders is really going to be an enduring feature going forward.
So much. And to round it all off, Dr. Jankowska, any additional?
Yeah, definitely. I'd like to take it back to my foundational training as a geographer, which is place matters. And I would encourage anyone doing any kind of work in terms of equity or social determinants is always come back to the place, right? Where is that person? What's their context? What are their surroundings? Because a single mother raising two kids in one neighborhood is going to be entirely different from a single mother raising two kids from a completely different area. What kind of resources does she have access to? What kind of places is she taking her kids to play? What kind of air is she breathing? All of those factors, both in business and in research and in just general decision making, I think so often we take the person out of their context and we try to make decisions for them based on what we know about them as a person, and we forget that they are bound to that place and the context that they're in. And so the more we can learn about that place and the more we can learn about the situations that they're dealing with, the better we can start advocating and trying to design interventions or whatever it is we're trying to do. So I think that goes for business owners, for anyone. Try to remember your context, because that shapes so much about where we see trajectories, both where we came from and where we're going.
So much. I couldn't echo that more, putting the person or the humanity back into the data itself. So, and how important that is. So I want to thank you all for sharing your stories, and the audience for participating and being part of this as well, and how we can all shape the future story to make the world more equitable together. So thank you all very much, and I wish you all a great day.
Thank you.
Brian.
Thanks, Brian.